Welcome back, everyone. Today, we're diving into a complete clinical and therapeutic explainer on bronchitis. We're going way beyond just that basic, annoying cough to explore the cellular anatomy, the diagnostic challenges, and some really advanced rehab techniques surrounding bronchial inflammation.
Think about this for a second. What actually happens when the very airways designed to keep you alive suddenly turn against you? I mean, we've all felt that deep, exhausting chest cough, right? But today, we're going to examine the actual biological conflict driving that misery and see why the body's own defense mechanism sometimes becomes its biggest obstacle.
Here is our roadmap for today's explainer. 1. Meet your respiratory system. 2. When bronchi become inflamed. 3. Acute versus chronic bronchitis. 4. Diagnosis and medical treatments. 5. Physiotherapy and pulmonary rehab. And finally, 6. Protecting your lung health.
All right, let's establish our clinical baseline. Bronchitis is, quite simply, an inflammation of the bronchial tubes. Bronchi refers to your airways, and that itis suffix, that means inflammation. When these essential passageways get irritated, they swell up and overproduce mucus, creating a massive physical roadblock for oxygen exchange and completely altering the normal fluid dynamics of your lungs.
Section 1. Meet your respiratory system. I absolutely love visualizing the respiratory system as an upside-down tree. Think of your trachea as this sturdy trunk, branching out into the major bronchi, then splitting into smaller bronchioles, and finally ending in the alveoli, those delicate little leaves. Actually, fun fact for you. If you were to spread out all those tiny alveolar sacs, they would literally cover an entire tennis court. Crazy, right? And underneath this whole shebang sits the diaphragm, pumping just like a bellows to draw air deep into that massive surface area to oxygenate your blood.
Section 2. When bronchi become inflamed.
Now this is where things get tricky. It's basically a brutal 6-step domino effect. The second a biological intruder, like a virus or a toxin like cigarette smoke, breaches your airways, your immune system kicks off inflammation. The lining of your bronchi swells up, and these things called goblet cells go into absolute overdrive, pumping out thick mucus to trap the irritant. Because of all that swelling and extra mucus, your airway space shrinks drastically. This triggers a really intense reflex cough to clear the roadblock, which ultimately leaves you breathless as your body desperately tries to force air through those narrowed tubes.
Section 3. Acute versus chronic bronchitis. So not all bronchitis is created equal. There's a really stark contrast here between a temporary viral intruder and long-term structural decay. Acute bronchitis is just a short-term hit, usually following a winter cold and lasting maybe 1 to 3 weeks. Chronic bronchitis, on the other hand, is a whole different ballgame. It's actually a form of COPD where a patient endures a daily, productive cough for at least 3 months a year for 2 years in a row. It's a progressive structural disease marked by permanent remodeling of the airways, and you guessed it, it's largely fueled by smoking.
To put this into perspective, the specific location of the infection totally dictates the severity of the illness. In both acute and chronic bronchitis, the inflammation is strictly localized in the bronchial tribs. Think of them as the highways of the lung. But with pneumonia, that infection pushes all the way down into the alveoli, the leaves of our tree. Those tiny air sacs fill with fluid or pus, severely compromising gas exchange right at the capillary level. This makes pneumonia an immediate, high-alert medical threat compared to just a bronchial obstruction.
Section 4. Diagnosis and medical treatments.
So how do doctors figure out exactly what's going on? Well, they use a strategic diagnostic arsenal. A simple stethoscope can actually detect rhonchi, which is this low-pitched rattling sound caused by airway secretions. Chest X-rays are deployed specifically to rule out things like pneumonia. And for chronic patients, they use spirometry to measure lung function. They look closely at FEV1, which is just a fancy way of measuring how much air you can forcefully exhale in 1 single second. That exact metric perfectly maps out just how obstructed those airways have become over time.
And this brings us to one of the biggest medical misconceptions out there. When you're coughing up nasty-looking mucus, a lot of patients immediately rush to request a Z-Pak or some other antibiotic. But does the science actually support throwing antibiotics at bronchial inflammation?
The clinical answer? A resounding no. Look, green or yellow mucus does not automatically mean you have a bacterial infection. Most acute cases are viral, which means antibiotics are, well, completely useless. The color of your sputum just means your white blood cells are hard at work clearing out cellular debris. Prescribing antibiotics for a virus won't heal you any faster. Honestly, it just contributes to the global crisis of antibiotic resistance without giving you any actual respiratory relief.
Instead, real treatment entirely pivots on the type of bronchitis you're dealing with. Acute bronchitis? That's all about symptom management, rest, hydration to thin out that mucus, and simple pain relievers. Chronic bronchitis, though, requires a lifelong strategy. Absolute smoking cessation is step number 1 for sure. From there, medical intervention relies heavily on bronchodilators and inhaled corticosteroids to literally force the smooth muscle of the airways open and suppress that persistent, deep-seated inflammation.
Section 5. Physiotherapy and Pulmonary Rehab. Now, physiotherapy isn't just about movement. It's an incredible tool for actively clearing your airways to reclaim your quality of life. For chronic patients, feeling breathless just walking up a flight of stairs is absolutely terrifying. Respiratory physiotherapy targets and breaks that vicious cycle. By mastering airway clearance, patients directly improve their daily ventilation, which dramatically boosts their ability to exercise without constant fatigue. It puts them back in the driver's seat of their own health.
Techniques like pursed lip breathing and the huff cough are total game changers. They turn you from a passive patient into an active participant in your recovery. Pursed lip breathing actually creates a slight back pressure in your airways when you exhale, which physically prevents those weakened tubes from collapsing so you can fully empty your lungs. And the huff cough technique, where you exhale forcefully with an open mouth, kind of like you're fogging up a mirror, moves mucus up from your deep airways without exhausting your chest muscles or triggering a massive coughing fit. But it goes beyond just breathing exercises. Comprehensive pulmonary rehabilitation programs wrap exercise, education, and nutrition into one incredibly powerful recovery package. It's a multidisciplinary approach meant for truly thriving, not just surviving. Patients learn how to strategically conserve energy, safely build up their cardiovascular endurance, and optimize their diets to support immune function and diaphragm muscle strength. You really need that extra support to handle the increased metabolic demands of breathing.
Section 6. Protecting your lung health. Ultimately, the name of the game here is defense. Avoiding irritants, especially cigarette smoke, and staying up to date on your vaccines are your absolute best shields. The flu virus is a massive trigger for acute bronchitis, which makes the annual vaccine super vital. Combine that with rigorous hand hygiene and staying away from chemical fumes or severe air pollution, and you drastically reduce the risk of sending your airways into a destructive inflammatory spiral. I want to leave you with this final provocative thought to wrap up today's explainer. The power to protect your airways is quite literally in your hands. So, what action will you take today? Whether it's practicing that pursed lip breathing, scheduling a flu shot, or finally putting down the cigarettes once and for all, every single positive choice strengthens those vital branches inside you. Your lungs work tirelessly for you every minute of every single day. I think it's time we give them the support they deserve. Thanks for joining me, and take care of yourselves.